this is ostomy care, and in this case, what we're going to look at is colostomy care. This patient has an ostomy into the large intestine. It is on the left side of the body, therefore we have an ostomy into the descending colon. When you have the ostomy into the descending colon, then you do expect a thicker stool. And we'll talk quite a bit about that in the classroom. Also, usually through the ostomy bag, if it is a clear bag, you can see the ostomy itself. And so what we see is a nice red colored ostomy. That redness indicates good blood flow. Like I had said, a stoma that is red or a nice pink color indicates good blood flow. A stoma that is dusky or pale can indicate insufficient blood flow, and it needs to be reported immediately to the physician. Okay, so the ostomy bag is about 2/3 full of brown, thick stool. And when the bag is about 2/3 full, that's where you want to go ahead and change, either empty the bag, change out the bag, or if it is time to change the entire appliance, which means the bag and the face plate, then it's a good time to do that. So it is the face plate. Let me show you. This is the ostomy bag. It has a snap closure on it. This is the face plate. Patients will have their appliances that they will use and are comfortable with. So this is the face plate, and this sticks down to the patient. You have your snap closure, and this snaps into place like this. So the face plate can stay in place for up to 3 to 5 days. That's preferable. Although the bag can be rinsed out or changed out at any time. So I'm going to, after performing hand hygiene, I'm going to apply gloves. And remove the entire appliance. Now I can either do this, remove the bag first, okay? I want you to see the clip closure. Again, I'm speaking from experience. Do not throw a patient's clip away. They will be upset at you. The bags, patients do reuse bags sometimes. They're rinsed out. A vinegar solution helps decrease odor. Otherwise, the bag, after removing the clip, I'm going to go ahead and remove this clip. I need it for the next one. Will be disposed of into a biohazard bag. Now I'm going to remove, this is the face plate on the patient. The face plate sometimes has been reinforced with tape. That's often done if you get an opening, the seal breaks. Therefore, the feces, the effluent, will leak up underneath the face plate, and that's where you're going to get your skin breakdown. That's what's happened here, so it's time to change the face plate. I'm going to remove the tape, pull gently, hold the patient's skin down, As you remove the tape, you always hold the skin down so that the skin does not tear. As you're pulling up the tape. Always pull the tape towards the stoma. These are some principles of wound care that I'm talking about. And there's the removal of the faceplate. Now I'm going to change my gloves, and this goes into the biohazard bag also. Remove my gloves, wash my hands, apply more gloves. Again, we want to assess that stoma, nice red or pink color to it, and then peristomal skin. I had said in the classroom, your greatest challenge, one of your greatest challenges with a colostomy patient is to maintain skin integrity around the stoma because of the possible contact with the effluent. You're going to take a soft cloth, whether it's a washcloth. I like to use 4x4s, warm water, and a mild soap, small amount. And I'm going to clean gently around the stoma, starting near the stoma, going around, some mild soap, I'll come a little bit further out this time, and I'm just going to clean the skin gently. And continue to clean until all effluent is removed from the skin. After the cleaning, then you want to rinse. Again, going in the same pattern. It's starting near the stoma, using concentric circles, coming further out, and rinse the soap off. After the rinsing, then you can pat dry. Now the skin has to be absolutely dry for the faceplate that we're going to apply to stick down. In the case of skin breakdown, some type of a treatment needs to be applied as ordered by the doctor, and you want to recognize skin breakdown immediately before it gets any worse. After peristomal skin care has been done, then we're going to measure the stoma. This is a colostomy, and so therefore, the new faceplate, let me show you again. I want you to compare. Here's the new faceplate. Do you see the opening of the new faceplate compared to the stoma? Now you know that for a colostomy, the faceplate, the opening of the faceplate needs to be 1/4 larger than the ostomy itself to prevent compromised circulation by the opening being too tight. And so I'm going to measure using the measuring guide and see which one gives me a 1/4 inch larger opening than the faceplate. This looks pretty close, 1/4 inch. I think that might be it. Let's look at this one. What do you think? That looks to be just about a 1/2 inch larger. I think I'm going to go with this sizing right here. 1/4 inch larger. So now I'm going to come over here. And I will have to do some cutting. So I'm going to trace, center it, and I'm going to trace a guide for the cut. I'm going to take the scissors and I'm going to make my cut. Very tedious. I'll tell you the type of scissors that works really well with this are fingernail scissors because they have a natural groove in them. Once I get this cut out, then we're going to have to work on the edges to make sure we don't have jagged edges. Jagged edges can irritate the surrounding skin around the stoma, causing irritation and skin breakdown. Like I said, that's one of your biggest challenges with these patients. Once skin breakdown kind of sets in, it's really difficult to get it healed up. Let's see how this looks. Got a couple of jagged sides there. I think I need to go a little bit bigger. That doesn't look like 1/4 inch. All right, so I have just spent about 15-20 minutes cutting on this thing and trying to smooth the edges. Okay, you don't want the jagged edges. There's a lot of products that you can place down on the skin to ensure the adhesion of the tape onto the skin, but I'm just going to remove the backing on the tape of the appliance. I'm going to center it around the stoma. Try to get this tape to lay down flat, and on the mannequin, tape doesn't stick like it does on skin, so you won't see that. Okay? You can have the patient blow their belly out, and that will ensure that there's no wrinkles. You don't want wrinkles on the tape of the appliance, because that will be pathways in which effluent can travel up underneath the tape. And anytime that this barrier gets broken, then the barrier will have to be replaced, because the effluent is going to travel up underneath the appliance, sit on the skin, and break the skin down. You can hold the appliance down. Probably you're going to want to get the reservoir bag attached to the appliance. It's just like a Tupperware. Have them blow their belly out, snap it down. You have the clip. You probably want to do this twice. Roll it twice. And then snap it down. Make sure it clicks. Then you can hold and let the warmth of your hand create a complete closure of the tape on the barrier to the skin. So we did do a good assessment of this peristomal skin, looking for any indications of skin breakdown. The barrier is 1/4 inch larger than the stoma itself to prevent constriction of the stoma. The stoma is a red or nice pink color that indicates the good circulation. A dusky stoma would be reported to the physician right away, because that indicates compromised circulation and death of tissue. Patient is nice and clean with a new barrier. I will clean up supplies and keep my patient comfortable.